Good afternoon and welcome to the EMA office for day 338, where we've got some numbers to talk about, some vaccination to talk about, some snow to talk about, some cold weather on this cold Sunday day. And Sam, it is so good to have you back here. It's the
Thank you.
Sam show today.
There are a lot of questions under my name for question
You
and
and
answer
Chairman
day.
Kern.
So first, before we get into questions, we have our numbers for today. We are at 272,974 St. Clair County residents that have been tested, which is an increase of 952 from yesterday. We have 27,257 positive cases, which is an increase of 57 from yesterday. And that does include both males and females from under the age of 10 up to their 80s. And today our daily county positivity rate is 6.0%. And we are at 245,717 negative test results. We remain at 427 deaths, so no new additional deaths today. And for those who have completed the IDPH required 10-day isolation period, we are at 25,989. For state totals, 17,171,858 have been tested, with 1,162,154 positive test results, which is an increase of 1,631 from yesterday. And for deaths, the state is reporting 19,961, which is an increase of 35 from yesterday. For our hospitalization numbers in St. Clair County, currently we have 72 patients that are admitted due to COVID-related reasons, and 3 of them are on ventilators. Regionally, we have 113 patients that are admitted due to COVID-related reasons, and 5 of them are on ventilators. We have no new additional numbers in our congregate living facilities today, so I will turn it over to Chairman Kern for his update.
Thank you, Sam. Here's the zip code report for today. 62201 up 1 to 555. 62204 up 2 to 370. 62205 up 1 to 613. 62206 up 3 to 1232. 62207 up 1 to 557. 62208 up 3 to 1521. 62220 up 13 today to 1944. 62221 up 2 to 2613. 62223 up 2 to 1630. 62226 up 4 to 2999. 62232 up 6 to 849. 62239 up 1 to 433. 62240 up 1 to 150. 62243 down 1 to 717. 62254 up 2 to 768. 62257 up 1 to 330. 62258 up 3 to 984. And 62269 up 3 to 3,075. 57 new positives out of 952 people tested, bring our county positivity down to 6%. That in turn brings our rolling average down today to 6.4%. Regional positivity is also down, and that number is at 5% today. Bond County, 1.1%. Clinton County, 2.4%. Madison, 7%. Monroe, 13.6%. Randolph, 2.2%. St. Clair's at 5%. And Washington County's at 13% today. So the numbers are mostly down. Our hospitalizations are ticking up a bit. I hope that's not a result of Super Bowl Sunday, but we'll find out. The numbers seem to be holding in a downward trend.
That's what we want, downward trend. And as we said, today is our question and answer day. We're going to take some of them. We'll try to answer as many of them as possible. And Sam, you get to start off. Randy Randolph, the operations manager, is going to be sending those questions to you.
Thank you. So Sam, first question is, I moved to St. Clair County and my physical ID still has my old address. Will I need to update that before I can be vaccinated, or is bringing a utility bill or something of that nature enough to prove residency?
Yes, if you bring a current utility bill with your new address, as long as that matches your ID, whether that be a driver's license or a state-issued ID card, that is acceptable to prove residency.
Okay. The second question, this is actually a two-parter. Were any of the out-of-state or out-of-county people able to get vaccinations, or were they all turned away? And then part two of this, I understand Illinois is going to 65 and under with pre-existing conditions with hypertension, heart disease, et cetera, on 2/25. I fall into that group. Can I expect to be contacted sometime after the 25th? And yes, I registered on the site as soon as the ability was posted. Thank you.
So for the first question, talking about individuals that were out of county or out of state, we did vaccinate some people that were out of county and out of state, but we have since stopped that earlier this week. And now we will only be vaccinating any individuals that live within the state of Illinois. And the second part of that question, moving into further phases of 1B, we are working our way through the 65 and up right now. And as we get ready, and this is all dependent on the amount of vaccine that we receive, as we are ready to move down to further subsections within 1B, we will be sure to put that out on all media outlets, including the Facebook page for both EMA and the health department.
Okay, great. Thank you. The next person asked, obviously natural immunity has played a role, as I know many people who have been around COVID sick people and have not gotten sick or tested positive. Has that been tracked by the health department?
The answer to that is yes, to an extent. That is information that our contact tracers do obtain from individuals that are positive. We don't post those numbers anywhere, but yes, that is information that is obtained.
And I think it's important to point out too here that there's not an unlimited natural immunity either.
That is correct.
There is only a time frame that you, if you've had COVID, that you're
Correct, that you are in that safe
protected.
zone.
Right, exactly.
Yes.
The next person writes, which vaccine is being given, Pfizer or Moderna? Are the shots being given by nurses? If not, then by whom? The governor has added health compromised individuals to 1B, to the 1B group as of February 25th. How is St. Clair County going to handle this? Thank you for keeping us informed.
So as we've said, we will be letting everyone know through all of our media outlets when we move into those further subsections of 1B. We give both Pfizer and Moderna. It really depends on what we receive from the state. We are happy to receive whatever they send us, so we will give both of those. And for the second part of that question, are shots being given by nurses? Yes. Everyone that is giving vaccinations at the mass vaccination site at the Belle Claire Fairgrounds is a licensed medical professional.
Excellent, thank you. When the next eligibility group opens up, ages 16 to 64 with health conditions, will you narrow the group by age as you have done before in previous groups?
I don't think we have an answer to that right now. That is a little further down the road than what we can see at this point. As we've said, it will depend on our allocations that we continue to receive from the state and looking at the numbers of people that fall into that category. So we'll make those determinations a little farther down the line.
Awesome, thank you. A lot of questions that came in today about second doses. So this person wrote, how and when will folks be contacted about the second dose? Will sign up be in the same manner once they are contacted?
Yes, you are absolutely right. So for those of you who have received your first doses, you'll receive the notification to sign up for the second dose the exact same way. You will receive an email. You will receive a way to sign up for a specified date and time, and it will be the exact same way you signed up for the first one. So don't be nervous if you haven't received the notification. It will not come to you immediately. It will be probably about 7 to 10 days out from when your second dose is due.
Okay, great, thanks. Someone asked, when will you start looking to vaccinate others in 1B? And I'm assuming they're meaning outside of the underlying.
Yes, so again, this is all gonna depend on how quickly we can move through the remaining part of 1B that we have and vaccine allocations as we move down the road.
That's always been the crux with the whole thing is how much vaccine do we have. So Is there a way to get my name taken off your list for vaccinations? I was able to get vaccinated through Walgreens, and I don't want to slow down someone else's process by staying on your list.
We would absolutely appreciate that. Please feel free to message the EMA Facebook page with your name and that you would like to be taken off of the list. They will then forward that to us, and we can get your name taken off.
Great, thank you. The next person wrote, in yesterday's broadcast, it was mentioned that the healthcare foundations in the area are working with the same list the health department has to get vaccines out to people. I personally know of many who have been vaccinated at Walgreens and in other neighboring counties based on the location of their employment. Is this being tracked in the county? Could the health department be going off possibly faulty, inflated numbers of 65 plus and med staff they think they have yet to be vaccinated, who in actuality have been vaccinated already, but are not tracked in our county system? Is the health department waiting for people to respond to emails sent and they just aren't responding? Could this be holding up moving on to qualified individuals and 1B like educators?
So for the facilities that are helping us as St. Clair County vaccinate, which are both of our hospitals in this area, both of Memorial's and St. Elizabeth's, they receive their names from us, from St. Clair County, and those names come off of the vaccine notification list. And once we send them to either hospital, they're removed from our list, and then we continue to work our way down. Now, Walgreens is not. And anyone that signs up at Walgreens for a vaccine, those names do not come off of our list. So again, if you have been fortunate enough to be contacted by Walgreens and you were able to make an appointment and you would like to take your name off of our list, we would be happy to take you off so that someone who has not been able to schedule a vaccine yet can get done quicker.
Great, thank you. It's been mentioned that the vaccines are for people who reside in Illinois only, and that people with out-of-state licenses were turned away. How will military families who live in the area who have state licenses and registrations prove they live here in Illinois so they don't get turned away from the vaccination sites?
So that's a very good question because obviously we have Scott Air Force Base that is in St. Clair County. So if you do have a out-of-state driver's license and you weren't able to get your vaccine at Scott Air Force Base, you can certainly sign up at any one of our locations. Again, please be mindful of the criteria that we are vaccinating for at the time. But all you need to do is bring your driver's license and a current utility bill so we can match your name and see that it is current and that is acceptable for proof of identification and proof of residency.
Great. Thank you. I understand the eligibility for COVID-19 vaccine, but I need to ask, if there is a mentally challenged adult that is under 40 that lives at home with parents and has not been able to attend his or her adult day program, will they have to wait until the eligibility gets to them by age, or at some time will you start giving the vaccine to individuals with disabilities no matter the age?
So at this point, the guidance is that we follow is given to us by the state. And at this point, that individual would have to wait until they fall into one of our categories, whether that be age or underlying health condition. And if the state changes that guidance, we will certainly follow whatever they put out. But right now, that is the guidance that we're following.
Okay, thank you. The next person wrote, what percentage of people have been vaccinated in St. Clair County?
So as of today, we have administered 22,089 doses. And of that, 5,426 of those individuals are fully vaccinated, meaning that they have received both doses, and that does equal to 2.1%. And as a county, we are averaging over 1,300 vaccinations given daily. So we are well on our way to, be moving down the road, getting everyone vaccinated.
And that information's all obtainable on the IDPH website.
That is correct, yes, where you would go to look up all of the other information, mitigations, where we fall with the county, number of positives and negatives. That is another subsection you can find information on.
Okay, thank you. If a person works and owns property in St. Clair County, but they live in Missouri, are they allowed to sign up for the vaccine in St. Clair County?
So as we've said previously, we have to have some sort of proof that you have current residency within St. Clair County. So we would need a current utility bill to match your name on the bill with your ID card.
Okay, thank you. When will all those in 1A be notified to get an appointment for the vaccine?
So 1A was frontline medical providers. If you do fall in 1A and you have not received the vaccine yet, and you would still like to, please do sign up on the vaccine notification form that you can find from the EMA Facebook page, the Health Department Facebook page, as well as the county, St. Clair County website. You can go put your information in there, and it does allow you to check that you are a frontline healthcare professional, and we go through those lists and look at the priority categories that we are working on, and we can move forward with that.
Okay, thank you. Next person wrote, I registered with the county and BJC. County notified me first, and I got my first COVID vaccine on February 6th. BJC notified me on February 11th to schedule an appointment. I didn't respond. Is that the right thing to do?
Absolutely. We do know that some people are registered on multiple sites, hoping that between one or the other, they are able to get a quicker appointment time. And if you have previously registered and you receive something after the fact, the best thing to do is just delete it, and there's nothing else that you need to do with it.
Great, thank you. The next person asked, why are other counties such as Madison County setting up special times for educators to get the vaccine while St. Clair County has done nothing in this regard?
So we are actually in the process of setting up a vaccine date and time that will be specifically for our educators, any remaining first responders that we have in St. Clair County, and any other 1A frontline healthcare professionals that are still needing the vaccine.
But right now, we're really trying to get through that 65
Correct.
and older population. They're the most vulnerable to COVID-19, and so the goal is to try to get as many of those people above 75 vaccinated as possible.
Yes, we've stated from the beginning that those are our priority populations, as they are the most vulnerable.
Okay, thank you.
Wasn't the CDC came out here just recently, as far as educators, the way we're scheduling it is okay? So, but we are working towards that, hopefully in the
Yes,
very
we are.
near future.
We have received a lot of, questions about educators in St. Clair County, and we've been working with ROE, which is the Regional Office of Education, on a plan, and we are moving forward with that to set up a specific date and time for our educators.
It's just, if we had unlimited vaccine, we would be scheduling everyone, but
Oh, absolutely.
the prioritization occurs because of, we only have so many doses available and only so much capacity to put them out. Although we've got a lot of capacity right now, we're still looking for more doses, but hopefully we'll get this teacher clinic going as soon as we get that 65 and older population tackled in a manner that we feel comfortable with.
Yes.
Okay, great, thank you both. Thanks for all you are doing for us, especially in this bitter cold. My question is, after you have completed 65 and up and educators, will you tentatively be moving to 60 and up or 55 and up? I thought I saw that that the state plans to add the 16 to 64 with underlying conditions later this month. That's a lot of people. Thanks.
So as we've stated previously, our priority population is at 65 and up, and obviously 75 and up even more so. As we feel that we have appropriately completed those categories, we will then move further down the tier list and start opening it up to more individuals that fall within those subsections of 1B.
But the governor's office has said that on the 23rd, we will be moving into another category of 1B, which is people with pre-existing health conditions.
Correct.
We'll probably be on target to do that. And so we'll just move right into that category. Also, hopefully, we'll be through the educators by then.
Yes.
Okay. And just to be clear, that transition takes place on the
25th.
25th. Yeah.
25th, sorry.
Yeah, no, that's okay. Thank you. I had Bell's palsy about 20 years ago. I have read that has happened to a few people. I'm assuming they mean when they get the vaccine. Am I at a higher risk?
So we have had no reports or haven't received any information from the state regarding, reactions in that nature. But if we do, we will certainly be letting everyone know and posting, the information that we receive from the state.
Very good, thank you. I am a 39-year-old with cerebral palsy, an autoimmune disease, mild asthma, and weak lungs, in addition to several other conditions. Will I get the vaccine before the typical 39-year-old? Also, is there a way to make sure you have completed the St. Clair County vaccine notification sign-up form? I believe I have, but I would like to make sure if that is possible. Thank you all so much for what you do.
So when you've completed the vaccine notification form and you click the submit button at the bottom, you will see, that's a tongue twister. You will see something at the bottom of that page that states something to the effect of your form has been submitted. So there is no automatic reply via email or anything like that. If you have concerns that you have not completed it or that you completed it inappropriately, didn't put all the information that we need on there, you are able to go back and submit a second. But just because you haven't been notified yet, please don't continue to submit your information thinking that will get you a call or an appointment sooner.
Right, and if she or he or she, whoever is asking, does have a question about whether they're on the list, we do have the call center
Yes.
that's open, the 825-4447, that they can call and see if they're on that list.
And that is a live person Monday through Friday from 9 a.m. to 3:30. It may be busy, so please be patient. A lot of people are calling into that number for questions and clarifications on where they do fall. But that is a live person that you can speak to.
Great, thank you. If I am a St. Clair County resident and receive my first dose of vaccine on January 18th at Monroe County, can I get my second dose in St. Clair County? It appears Monroe is not receiving the needed quantity for second dose distribution.
So our recommendation at this time is it is best to receive your second dose where you received your first dose. And if you have questions about Monroe County and them receiving the allocations that they need to move on with that second dose, my suggestion would be to contact their health department, check on their Facebook page. I know that they are posting a lot of information there for any updates, and as well as on the health department website for Monroe County. They're putting some updated information there as well.
But Sam, it's apparent there are many people that traveled, got vaccine in Florida or wherever when they were on vacation or when they were there. So likely we'll be doing second doses in the county if you didn't receive, even if you didn't receive your first dose in the county. It's just part of the way it is going to have
It is.
to be. So-
And perhaps I should have stated, if it's possible, we would like you to receive your second dose where you received your first. But as Chairman said, we understand that there were some people traveling and had the opportunity to get the first dose while they were out of state. And it's great that you were able to receive it. But yes, we will not be turning anyone away because it is a second dose and not a first, and they didn't receive it in St. Clair County.
But the way the state is doing this, if they gave 500 doses of Moderna 4 weeks ago, they'll be sending 500 doses and calling it a second dose batch. So
That is correct.
they're saying you should be using this for second doses. So wherever the first dose was given, the second dose should be there. But in some places, maybe that's not the case, and so you can receive your second dose in the county.
Yes, you're absolutely right that when we receive, whatever we receive today, if we received a shipment today, depending on whether it was Pfizer or Moderna, so 21 or 28 days later, we should be receiving that same amount to cover second doses for the first that we've already given. And the state has assured us that we should not be holding back any doses, that they will be continuing to provide not only weekly allocations to continue first doses, but also supplementary vaccines to cover second doses that we've already done.
We're not holding back anything, we're putting.
No,
it in
we're
ours.
throwing it all out, yes.
Okay, thank you. Chairman Kern, one question that came in for you. This person wrote, on one of the daily briefings, Chairman Kern said that the vaccinations would be given to residents who lived in other counties. Recently, he said people had to reside in St. Clair County. Which of these statements is correct?
So I think they're all correct. Illinois is sent vaccine based upon the population of Illinois. The county then is transferred vaccine from the state to us based upon our population and the population that lives here and various factors that they factor into your dosage allotment. So really, the goal is that where you live is really where the vaccine comes that should be given out. But that being said, people work here that live in other counties, and they're eligible because they're working here for vaccine. And we look every day, we're all in a region here. We're in Region 4. We're part of many other counties. And so as long as they're all going by the same guidelines, that we're getting to the most vulnerable population first, these borders really are difficult to say that really makes sense, that if somebody lives 100 feet over in Monroe County, they shouldn't be eligible to be vaccinated. We all want to try to work together. Our problem that happened last week, and hopefully that is behind us, is people tried to game the system. They weren't they weren't allowed, or by rules they weren't supposed to get the vaccine here, and yet they just cheated and signed up and clogged up the system and caused a lot of issues. So at that point, in the IT fix, one of the ideas came up that maybe we had to limit it to the zip codes of St. Clair County. I think the fix was able to go beyond that, and so that isn't necessarily one of the ways that they're keeping people from signing up that don't belong. So we're all going to get this shot, and it's going to come according to CDC guidelines, whether it's age, whether it's health matters, or whether it's just being part of the general population. We're all going to get this shot. The reason for all these restrictions, there just isn't enough vaccine to go around right now. As soon as all that vaccine goes around and comes here, the demand will still be great, but we'll be able to deliver on that demand to everyone. It's just right now we're focusing on the 65 and older population. St. Clair County residents certainly are our priority, and those are the ones that we're giving it to. But at some point, if there are areas that can't get their vaccine out and they need our help to do that, as long as we've got the vaccine and we get an allotment, whether it's their allotment or our allotment, we'll be happy to work to try to build the health of the community. After all, you can maybe make your rates go down in one small area, but if the whole country really isn't at a COVID positivity rate that's acceptable, we'll just be bouncing back and forth between all of us to get to the point where we need to be.
Well, and what we said from day one, since we started the vaccine, it's a logistic nightmare, and you just summed it up there, because even though our allotments is based on our population, when we talk about people who maybe were in Florida and got theirs and they live here, we have to have that cushion to be able to meet that second dose. So that's one of the reasons why there are some of those restrictions that we have to do here locally. And you said it best. If we had an unlimited supply of vaccine, come from wherever, we don't care. It's all about putting the needles in the arms. But right now, making sure that people who have got their first dose going to get that second dose is really important. And it's a nightmare, a logistic for the health department, for the medical staff to, we just don't come on here every day and make up these numbers. They know what they have to have 3 weeks, 4 weeks from now based on the amount of shots that they're giving. So please, that word that we've been using for the last couple of weeks, patience, is what we've got to have.
But we're getting it done.
Yes.
And we just encourage people to be patient. As Herb said, don't try to game the system, because it's not going to work. You'll show up for a shot and you'll be turned around. Now, hopefully, we've got it so that if you try to cheat and make an appointment and you're not eligible, that your appointment will be canceled, or you won't be able to make the appointment in the first place. We're going to get these needles in arms, and we're going to get them in the arms they need to go into. That's the goal.
Okay, thank you. And just one last comment that came in. This person wrote, "Many thanks and gratitude to each of you. We are finally seeing a light at the end of this tunnel." And that's all I have.
Very good. We've been talking about that tunnel for some time now, and I know our medical staff and the National Guard that are out there in that tunnel at the mass site in these cold days are seeing that light. Some days, like today, when it's wind chill below zero, they feel they wish that light was brighter just to give them some more heat. We're doing all we can, but day 338, we're here. Don't forget, in order to start the process of showing your interest in getting the shot, you can sign up on the EMA page, or the health department, or the county. So far today, we've had 78,076 citizens that have signed up. That's 838 since yesterday, new interest, and that's the list Sam talks about. That's the first start of showing that you want to get that shot. So numbers are going down. We're still doing shots every day. We will be closed tomorrow due to the prediction of anywhere from, depending on which weather you want to listen to, 3 to 8 inches is what I'm going to say is what our last report that we got. Chairman doesn't agree with that, but But
I'm always optimistic.
always, you don't want no snow. But just remember, our highway crews are gonna be out tonight. We've been in touch with them. We'll be going into the snow mode, along with staying in the COVID mode. Remember, our pets, bring your pets inside, because it is definitely cold outside.
But we won't be operating Monday, but we will be operating Wednesday. Is that correct?
Tuesday,
Tuesday.
we come back
Tuesday.
Tuesday.
Tuesday, we'll
Yeah.
be back Tuesday.
And then Wednesday?
And then Wednesday?
Yes.
Yes. and
Yeah,
then we'll
so
be doing
normally
Tuesday.
we're off on
Wednesday,
Wednesday.
Yes.
correct.
So
We just-
instead of taking the day off on Wednesday, we'll be
Yeah.
working Wednesday. It's just Monday is the day to
And that's
to get
both
rid of the
sites,
snow.
at the fairgrounds and at 330 West Main, our other site. Both of them are closed tomorrow, because now if you wake up in the morning and the sun's shining and no snow, so it's President's Day, so it'll just be a day off anyway, but I don't think that's gonna happen. So everybody, please, we'll be back here shortly with Cindy to translate this into our Spanish communities, and we'll be back tomorrow with day 339. Everybody have a good evening.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.
Buenas tardes. Hoy tuvimos a Sam Bierman del Departamento de Salud que nos informó los nuevos casos del condado de St. Clair County, que son 272,974 personas examinadas, con 27,257 casos positivos, con 57 nuevos casos de ayer, hombres y mujeres entre la edad de 10 a 80 años, 245,717 casos negativos, con 427 muertes. Y 25,989 personas han completado la cuarentena requerida por el Departamento de Salud de 10 días. Los números estatales son 17,171,858 personas examinadas, con 1,162,154 casos positivos, con un incremento de 1,631 nuevos casos de ayer, con 19,961 muertes, con un incremento de 35 nuevas muertes de ayer. En los hospitales de St. Clair County tenemos a 72 personas hospitalizadas con 13 ventiladores, y en la región 4 tenemos a 103 hospitalizadas y 5 ventiladores. Y hoy marcarnos de los códigos postales con casos positivos, que son 62201, 555 casos con aumento de 1, 62204, 370 casos con aumento de 2, 62205, 613 casos con aumento de 1, 62206, 1232 casos con aumento de 3, 62207, 557 casos con aumento de 1, 62208, 1521 casos con aumento de 3, 62220, 1944 casos con aumento de 13, 62221, 2613 casos con aumento de 2, 62223, 1630 casos con aumento de 2 casos, 62226, 2999 casos con aumento de 4, 62232, 849 casos con aumento de 6, 62239, 433 casos con aumento de 1, 62240, 150 casos con aumento de 1, 62254, 768 casos con aumento de 2, 62257, 330 casos con aumento de 1, 62258, 984 casos con aumento de 3, 62269, 3075 casos con aumento de 3. En la región 4 estamos al 5.0% y en el condado de St. Clair County estamos al 6.0%. Y hoy tuvimos una sesión de preguntas. La primera pregunta a Sam Bierman del Departamento de Salud fue: ¿qué vacunas se está administrando por el Departamento de Salud de St. Clair County? Y la respuesta es la Pfizer y Moderna. Todo depende de la que reciban ese día del estado. La segunda pregunta fue: ¿qué grupo está recibiendo la vacuna? Y por ahora solo a personas que sean 65 años en adelante mayores. La tercera pregunta fue: si alguien ya recibió la primera dosis de la vacuna, ¿qué es lo que tienen que hacer para recibir la segunda dosis? Y la respuesta es que el Departamento de Salud se encargarán de avisarles para darle la fecha de la segunda vacuna o donde se haya vacunado originalmente. Y finalmente se les recomienda que todos sigan usando el cubrebocas, y muchas gracias.